hepatic veins. So if we follow here's our inferior vena cava, right below the heart, coming here. And if we push our liver up a little bit and we have to chew away some of this liver tissue, you can see these big veins right here and here. Right? See these big tubes right there, and right there's another one right there.
Okay.
Those are the hepatic veins draining right into that vena cava. Okay? Then if we go back here, okay, so here's the big vena cava. Pretty easy to see. This first branch right here, which is really big in this cat actually, is the adrenal vein. Okay, going over to the adrenal gland, which is in there somewhere. Okay, that's the adrenal vein. The next big branch here is a renal vein. It's going to the kidney. Okay, so it's a renal vein. And we see that there's a branch off this left renal vein right here. This thing, right here. That little branch right off that renal vein. This is actually a gonadal vein, which is going to eventually go to the gonads. It should be running down here someplace, because this is a boy, isn't it? Is it not? Yes, it is a boy. Okay, so that's a that's a gonadal vein on this side. The gonadal vein on the other side comes right off of the vena cava, which is probably what's left of it on this side, going down to the other testicle. Again, these are the things that are not going to be there, but just so you know. Okay, so then we get his bladder out of the way. Wow, there's not much left of his aorta. That's unfortunate. All right, so we come down here, and we have this big vein on this side, coming over this way, and what's left of the other one on the other side. Those are the iliolumbar veins, right down the lumbar back area. And then we have this big split here. Okay, where it splits are the iliac veins. And if we follow those out into the leg, the largest vein in the leg is the femoral vein. Okay? Now if we go to the arteries in this cat are not good, but go up here to the arteries. Again, they pulled off the pericardium here, right, the sac on the heart. Okay, so we know that the aorta comes up out of the heart. Okay, it's coming up here. It's making this U-turn, and it's going to go down along the back body wall, right? And for whatever reason, they split that one open too. Okay. The first big branch off that aorta, when it comes out of the heart, we saw this on the sheep hearts. This first big branch right here is the brachiocephalic artery. And that brachiocephalic artery actually has 3 branches off of it. It has 1, 2, and it has another one going off this way. Okay? It's kind of hard to see. There it is. See the 3 branches off of there?
Oh, okay, yeah.
Okay, like 3 fingers?
Yeah.
Okay, the first 2 branches are the right and left carotid arteries, here and here. Okay, so the brachiocephalic comes up, it branches here, and then it branches here, go up to the head for the carotid arteries, and then the third branch, way over here on the side, goes out here to make the right subclavian artery. Okay? The left subclavian artery is the next major branch off the aorta after it leaves the heart. This is all by itself, just left subclavian on the left side. Comes up, follow it up. When it's under here, it's subclavian. Again, when they're in the armpits, they're axillary arteries, brachial arteries on the arm, radial arteries on the radius. Okay? It tells you to look for little vertebral arteries. You don't even have any remnants.
Yeah.
You should be able to see these little tiny threads coming off the aorta down here, which are all the little vertebral arteries that go out and lie in those subcostal grooves. But I don't know where those are.
Do any of the cats have them?
You can see some of them do, yeah. But again, you can't tag those, so I won't worry too much about them. Coming down in the abdomen now, the first major branch of the aorta. So here's our aorta.